Well, precision medicine has long been an inspirational vision, but the grand promise of the early days of genomics and such is still largely unfulfilled. The bright spot in that picture, however, has been oncology in general and breast cancer specifically, which has been a major success story. Breast cancer is where some of the most advanced, holistic, cross-disciplined, and team-driven comprehensive efforts in medicine are taking place today. I'm going to place the state of breast cancer therapeutics in a larger context during my keynote. I'm going to look at where it's headed. I'm going to explore the extent to which we're going to be able to extend the unique positioning of precision medicine in next generation healthcare and infuse that into oncology even at a greater depth than it's done today. So there are two primary reasons that clinicians and oncologists need to attend meetings like the meeting at Miami and to stay abreast of current research. The first is that your knowledge and your connections to the most prominent precision medicine teams at major research hospitals, teams who often come to meetings like Miami Breast, can be the key to extending a patient's life. And that's either by optimizing their treatment or by helping patients avoid the unnecessary and often very difficult, painful treatment protocols that might be unnecessary. You absolutely owe this to your patients. Another reason is that you need to be a highly credible source for patients with expertise in breast cancer and oncology in general. And it's important to be able to provide clear context for patients when they seize upon some new wonder cure or possibility or promising experimental treatment that they've heard about. You need to shoulder the full responsibilities your patients expect from you, which means not only being up on published literature, but on the various protocols which still have no real data, at least about 5-year survival times. It would be irresponsible to do otherwise, and your patients can't be as confident in you as if you're really in the midst of current research. So the way that the relationship for oncologists and treatment is going to shift is towards earlier diagnosis, towards earlier interventions, and towards larger survival times. That's clearly the direction of cancer treatment. Now, sometimes this means that there's been real progress. Unfortunately, at other times, it's artifact. There's earlier diagnosis, which seems to extend life expectancy. A fundamental challenge is going to be the acquisition of the large data sets on new treatments and to really refine the big data processing and analytics that are going on these massive data sets. Major progress is likely to come through the formation of these large data sets, through data sharing, through more rapid learning, which is all underway today, and frankly, the field is moving quite rapidly. But by its very nature, meaningful data will take years to accumulate because short-term results can be very, very misleading. The hope is that more and more cancers will become manageable conditions for longer and longer periods, but it's important to realize that there will always be gray areas where the clinician's informed intuition is absolutely essential in making good judgment calls. The key reason that you want to hear my keynote is not for the updates on latest technological approaches in key areas. In-depth exploration of these realms will necessarily be covered by domain experts in their talks. And the domain expertise changes very, very rapidly. What I will provide is context and a sense of direction, an indication of which key areas look most promising and what's most compelling. Sometimes we have our heads down and it's hard to keep in mind the big picture and what its implications are and how the field is moving. One takeaway from my keynote is that these are early days in oncology, despite the massive progress we've already made. We may be on the cusp of breakthroughs that have substantial impacts on society and certainly on the prospects for individual patients. The field is moving quickly now, so any way that we slow or halt progression in a patient can yield new hope and buy time for new possibilities that might even bring curative solutions, which of course is what everybody really wants. As we're approaching an era where machine learning approaches and AI are going to infuse into all aspects of medicine, particularly oncology, there's no doubt that physicians will continue to retreat from standalone diagnostics and that they'll increasingly depend upon broad decision support tools and algorithms. Oncologists are not going to compete with machine learning tools, but they're going to employ them to deepen their analyses, to strengthen their treatment recommendations, and at the same time, to make sure to identify where the technology can go wrong, which is extremely important. Over time, we will be ceding more and more to algorithmic approaches as they are demonstrated to be increasingly reliable. More and more physicians are going to be in the role of interpreting, guiding, and managing patients. But the instincts of seasoned, informed physicians to guide the treatment of their patients at interpretive boundaries and in gray areas is not going to go away. 5-year survival statistics obviously aren't available for new treatment, so oncologists will have to make decisions in these realms based on limited information. You have to know where research is going with new treatments, what studies are underway, and you have to communicate and explain to patients and help them deal with the ordeals they are experiencing. I decided to come to this meeting because I've been involved with next generation healthcare for some time, and with the infusion of big data approaches to medicine. And frankly, it's been disappointing in much of medicine how little that's been able to deliver at this point. Oncology is an exception to that. It's been made amazing progress. And the idea of coming and being able to interact with people that are dealing with breast cancer routinely, and to talk about the context, the larger context of the radical changes that are occurring as we move towards next generation healthcare, were appealing to me. And so I'm very much looking forward to coming down and not only giving a keynote, but actually talking with the various physicians who are attending the conference and understanding what it's like, in the field as you're dealing with your patients, and a richer sort of understanding of the challenges that you face as you're trying to introduce the technological approaches that everybody sees as being very, very helpful and hopeful.